which picks up on the talking point that Dr. Koh made of the impact of injury and violence in terms of the leading causes of death. It's the fifth overall leading cause of death. That's unintentional injury. And for ages 1 through 44, it's the first leading cause of death, as you can see on the slide. And it's followed by homicide and suicide. So the impact overall is from this topic area is really enormous. The next slide fleshes this out even a bit more, showing that these 181,000 deaths are 7%. If you go to the next slide, please. 7% of all injury deaths. They represent 5% of all hospital discharges for industry. And as Dr. Koh mentioned, over 32 million emergency department visits. On the next slide, we turn to causes. Okay? There are 4 major causes involved here. Motor vehicle traffic, which, as you can see, has actually had a considerable decline since 2006. Poisoning, which has actually doubled since around the year 2000, going up in large part because of opioid poisoning. In fact, opioids are 40%, at least 40%, are involved in all the injury deaths from poisoning. The falls has also increased. We'll talk more about that in a minute. And firearms has actually been relatively constant over time. If we look on the next slide at the figures by age, we can see that there are really 3 distinct patterns here. There's the pattern for falls, which increases without end as people age. There's the motor vehicle traffic and firearms, which peak in the late teens or early 20s, and then there's poisoning, which peaks around age 50. That's all in terms of injury deaths. If we turn to non-fatal injuries on the next slide, we have 2 additional causes involved. There's struck by or against, which has to do with people being struck by objects or against objects in a variety of different ways, and also overexertion. And we see pretty much the same pattern that we saw before for the non-fatal, although here for the non-fatal as we saw for the fatal, although here we can see that falls, in fact, is a kind of a U-shaped curve. Interestingly enough, and I think really not well known, that this increases as much as it does for young children. This is a very complex area, and we're going to kind of peel it apart a bit, piece by piece. So a subset of all of this is in work-related injuries. So if we can move to the next slide and then the slide after that. This is work-related injuries for ages 16 and above. What we can see here is that these work-related injuries have declined. In fact, they're below the 2020 target at this point, although clearly it's early in the decade, so we're not quite sure as to where we'll be going. But it's interesting. We do have a relatively smooth pattern, a smooth pattern here. We can open this up a bit more in the next slide and look at this in terms of the work-related injuries that are actually treated in emergency departments. This is about half of all the injuries we saw on the prior slide. And what's distinctive here, I think, is that the injuries are higher in males than they are in females, and higher at the younger age groups from 15 up to 24. There's then a dip, and then these work-related injuries increase, and they're, again, significantly higher in the 85 and above compared with the earlier age groups. On the next slide, we go from injuries to injury deaths. Again, this is in the age group 16 and above. Here we can see that the most significant difference, I think, is not by race and ethnicity, although there are some differences there, but the difference between males and females, where the male rate is much, much higher than the female. Again, that's in injury deaths. Turning to the next slide, we can look at this more specifically by age. What we see again is a relatively uniform trend by age, except when we get to age 45, when the rates begin to climb for 45 to 54, up to 65 and above, where the rate is much higher. So here we see the low points being from ages 20 up to age 44, and then we see an increase. Now, looking at on the next slide, the industry in which these deaths occur, there are four major industries that we see. First is agriculture, and while we see the figures kind of going up and down, the overall trend here is slightly down. The trend is much more steeply down in mining, where although what we saw in 2010 were a couple of major incidents which moved the curve up. The curve is also down in transportation and construction, and if we look at all industry, we see a figure that is pretty much flat when we look at it overall over this time period from 2004 to 2010. And one might think, given the industries that are identified here as the ones with the highest rates, that this would show up geographically. And if we go to the next slide, in fact, it does. We can see that the highest rates are in West Virginia in red, Wyoming, and Alaska, and the lowest rates are in Massachusetts, California, New York, and New Jersey.